Welcome back to the California Conversation. I'm Tess Abraham, and welcome to the country of California. Because if you've seen recent news, then you will see that our governor isn't really acting like the governor of a state as much as he is acting as the head of state, or as one would say, a president entirely. Now, what am I talking about? Well, we have a lot to unpack, from our governor announcing on an international stage that California will re-engage with the WHO, to then forming coalitions with other states across our nation that directly oppose the federal government, to even passing legislation in California that take away medical freedom and individual choices from people and families who live here. We are going to get into all of it today and really underscore why this moment and why these choices matter for you. But before we get started, make sure to like this video, subscribe to this channel if you haven't already, and ring that notification bell so that you stay up to date on all things California politics. And if you want more information or you want sources cited in compiling today's episode, then you should check out the corresponding article on my website, which is linked below. All right, there has been so much happening. I felt like every week in January needed to be multiple episodes, multiple weeks at a time, because something was exploding every single day, and I just could not choose which topics I needed to dive into and discuss. So this week, we are going to tie together a few different actions on behalf of our wonderful governor and tie up some major themes that we have seen happening in the state of California. Now, first up is actually a federal action, because on the 1-year anniversary of his inauguration into office, President Trump officially withdrew the United States from the World Health Organization, or the WHO. Now, this was a move that he had started on day one of his presidency, but because of how certain things were written into law, it needed to take a year to fully withdraw our nation from the UN organization. So just to back up for a second, what is the WHO? What do they do? Why is this significant? So as I said, this is an agency within the United Nations, or the UN, and they really oversee global health policy. And so that looks like things like pandemic response, stuff that we saw during the COVID-19 pandemic. It also means vaccine handling and cross-collaboration with other countries to try to determine what the best course of action is in regards to those public healthcare policy decisions. Now, what our withdrawal from the organization means is largely that the US just will not fund this organization anymore, which is a really big deal for the WHO, because in 2022 to 2023, the United States contributed $1.2 billion, which was well above, millions above what other countries were putting in. So we are no longer funding it, but it also means that our officials in the United States will no longer have a seat at the table, so to speak, in the WHO and in those decision-making conversations. But it also means that as the US, we are no longer obligated to abide our policy by the WHO's recommendations. And so really this is signaling a fundamental shift, which is a core part of President Trump's administration and his policy positions in general, of shifting away from sort of international relations and sort of a global health stance on things like health policy, and instead is moving more toward individual freedom, toward the United States actually reviewing the recommendations of agencies like the WHO and having the freedom to set our own policies that might align with what they recommend, but might also defer from what they recommend. President Trump cited the fact that the WHO is politically captured by bad actors. He says that they are far too involved with China. And he also cited their mishandling of the COVID-19 pandemic, all as reasons for why our country should not be financially supporting this type of organization, as well as should not be bound to the types of policies that they recommend. And so we see this shift even in HHS's announcement about this. It said, quote, "Going forward, the U.S. government will continue its global health leadership through existing and new engagements directly with other countries, the private sector, non-governmental organizations, and faith-based entities." And so really we're starting to see even the America First priority that President Trump has put at the top of his docket in all of his policies bleed now into healthcare as well. And I really want to pause here and just bring home a specific point that will come up later as we connect the dots. But that is that President Trump and the Trump administration has really hammered in the idea of individual responsibility, of personal freedoms, of the individual ability to make decisions for yourself. And that is a core tenet of conservatism. So if we are people who believe believe in conservatism, and I am someone who does, then we must remember that it all comes down to individual responsibility. It is not the job of the government or the job of other countries' governments to tell you what decisions to make. You should be well informed. You should have all of the facts at your disposal. There should be investigations. There should be research. There should be evidence. But ultimately, the government should leave it to the people to decide, one, how they want to be governed, because we have a say in our government, but then two, how to make the best decisions for themselves and their families. And so we're starting to see that shift on a global platform here as America shifts out of the global sphere and instead says we are going to start making decisions for our own country, and that will involve the ability of our own people to make decisions for themselves. Now, I know what you're thinking. This is a federal move. So what in the world does this have to do with California? Let me tell you, our governor, as I mentioned at the top of the show, has decided he doesn't really want to act much like a governor these days. I mean, he has his eyes set on the 2028 presidency, and so obviously that's where his priorities are, and it is showing. Because 3 days after President Trump's announcement that we have officially withdrawn from the WHO, Gavin Newsom showed up at Davos, Switzerland, which is where the World Economic Forum is hosted, and he announced on an international stage that California will be rejoining the WHO despite our federal government pulling our entire country out of it. What does this mean? Because it's really unprecedented. We are the first state to make this kind of move, and it's still fuzzy on if California is able to join the WHO or not. But basically what this means is that there will be potential for funding to the part of the WHO that California says it wants to collaborate within. And then on top of that, more importantly, it means that the scope of the policies that the WHO sets will have bearing on the policies here in California. And so we will look to align our pandemic response, our emergency response, our vaccine guidance, any sort of this kind of public health care. We will seek to align that with the recommendations made by the World Health Organization. Again, in spite of the fact that our federal government will not be aligning itself with those recommendations automatically. So this clearly is looking to undermine what our federal government is doing. I mean, President Trump has completely cut funding because he does not believe in the WHO, and yet California is now setting itself up to potentially give funding if it is going to be a part of this organization. But then more than that, our president was seeking to remove legitimacy from the WHO to say there will be one voice that we will consider, but we will consider a multitude of voices and do our own research as well. And now California is just giving legitimacy back to the organization by bringing its recommendations onto the domestic front by making sure that they are implemented here in California. So it stands directly at odds with the policy priorities of the Trump administration, as well as with the sort of impacts that our federal government pulling us all out of the WHO will have on the entire country, and instead is insulating California away from those impacts. But here's the thing. If you think that California as a state entering a global alliance with other countries in spite of the guidance and the policy direction that is set by our very president, if you think that that is crazy and that must be just a wild move that is pulled out of left field by our governor, then you would be wrong, because this is just the latest in a long list of actions that Gavin Newsom and other California legislatures have taken over the past few months to really move ourselves away from looking at what the federal government is doing, and instead is setting up California, again, as pretty much its own country, its own little island here. So what has he been doing? Well, in December, he announced a public health network innovation exchange, which is just a mouthful. But Gavin Newsom describes it as, quote, a new California-led initiative to modernize public health infrastructure and maintain trust in science-driven decision-making. So just to simplify this, it is basically an organization here in California that is directly in response to RFK and the steps that our federal government is taking to reduce the vaccines that are on the vaccine schedule. So this happened in response to that. It is basically saying that California is not going to be swayed by the science decisions that are made at the level of the federal government, but that we will have our own organization here in California that will really look at producing those results. And so it's just a way to say, we don't agree with the stuff that the MAHA movement is doing. We don't agree with what RFK Jr. is doing. We don't want to abide by that. And so we're going to start to create our own innovation here of public health that says we're going to do our own research into it, and we're not going to listen to the research done by these federal organizations. But it's funny because it says in its very description that it is science-based, it is data-driven. However, there are questions as to if that is really the case, because immediately Governor Newsom appointed several former CDC officials who have been very openly critical of the Trump administration, specifically in his second term. And so it starts to raise questions of, well, you just immediately appointed these very polarizing figures who don't like Donald Trump just as much as you don't like him. And so is this really a science-driven move, or is this a politically backed move? And there are people in the Democratic Party who are saying, look, we're not going to hide the ball here. We're just going to come out and make it clear that that is exactly what we are doing. Take, for instance, California Democratic strategist Stephen Maviglio. He is making it clear that health policy is a new front for Gavin Newsom just to fight Donald Trump on and oppose him on, as he has on many other fronts as well. And so he said, quote, the governor wakes up every morning and sees what Trump does and tries to do the opposite. And that's the case here. He's positioning himself as the leader of the Democratic resistance to Trump. Now, I would rather my governor wake up and think, how am I going to solve all of the problems in my state today, such as high cost of living, high crime, high homelessness? The list goes on of the things that he could think about upon waking. But at least someone in the Democratic Party is being honest about what Gavin Newsom and really what the Democrats are trying to do here in just trying to oppose President Trump. And so this move is not the only move that he's taken. In October, he created something called the Governor's Public Health Alliance. This includes him as well as governors of 14 other states, and it really focuses on how to set policy when it comes to healthcare. And so it's governors banding together to again say, we want to ignore the guidance by the federal government. We don't agree with it. And so we are going to create our own little group of how to set health policy in terms of, again, emergency response if there was another pandemic like we saw with COVID-19, and then that vaccine schedule. And then on top of that, there's also the West Coast Health Alliance. Just so many alliances and groups. This includes Washington, Oregon, Hawaii, and California. And this is specific to those vaccine recommendations. And so this says that our states are all going to collaborate together to give out a unified immunization schedule that will be followed by these West Coast states. So clearly, our governor has been hard at work, very busy with building these coalitions, building these alliances that really work to shore up California's health policy to be what it was under of a more traditional Democrat regime under the Biden administration, rather than being influenced by the evolving science or the new recommendations under the Trump administration. But what is so important to see is that this has not been isolated just to international affairs, and it hasn't been isolated just to even domestic affairs in terms of relations to other states and even the federal government. This has bled down into the policy that is passed by our very legislature here in California. And so that brings us to Assembly Bill 144. This is a bill that was passed in last September, so it is a new bill in effect for 2026, and it specifically looks at these very issues, things like vaccine recommendations, as well as public health policies. What it does is it creates a California-specific standard for things like vaccine recommendations and completely removes federal oversight overall. How does it do that? First of all, it locks in all recommendations from January 1st of 2025. So what it says is that California health policy will not consider any federal recommendations made after that date, which includes the new updated vaccine schedule that rolled out earlier this year from RFK Jr. And so that will not be considered at all. Any recommendations made in 2025 will not be considered. Only recommendations made before that date will be incorporated into California public health policy. So immediately we see that we are freezing any sort of science, any sort of investigation, any sort of studies that come out today. They will not be considered here in California. Additionally, it shifts authority solely to the California Department of Public Health. So this means that we no longer will be taking any recommendations from the CDC, from the AACIP, from HHS, where RFK Jr. resides and works. Instead, we are going to give all authority solely to the California Department of Public Health, and they are the ones who will set recommendations. They are the ones who will influence what needs to be covered by insurance. They are the ones who are just going to set all of the public health policy here in California. And lastly, this means that it requires any licensed healthcare providers in California to follow that California Department of Public Health guidance, which means that if you work here and you are a doctor or any sort of healthcare provider and you align more with what the federal government is putting out in its guidance on any topic in public health, that doesn't matter. You are bound and required to follow the recommendations set by California. And so, as you can imagine, for families and healthcare professionals who usually would advocate more for medical freedom here in California, this bill is an absolute nightmare. It completely ignores the entire Make America Healthy Again movement that has swept the nation, California included. There are people here who align with that movement and voted for President Trump because of that. It just rejects that model entirely. And really what it shows us is that California only believes in following the science insofar as the science agrees with what they have always believed and what the mainstream narrative has been about vaccines and the like when it comes to public health policy. So just to be clear, California will not cooperate with its own government, its own federal government who has oversight over it as a state, but it will collaborate with an international organization and with heads of states from other countries who do not have the United States and the American people as its main priority. Make that make sense to me. That should concern every American and every Californian because it completely changes how our system was designed to operate. And that should concern us regardless of what you believe on these things. It should not matter where you stand, whether you agree with Gavin Newsom's view of public health or you agree with RFK Jr. and the federal government. That doesn't matter. We should still be concerned about how states are interacting with our federal government, and we should be concerned about the laws that are being passed here in California. Which brings us to the ultimate question in all of this, which is how should states interact with the federal government on something like public health policy? Is this simply a states' right issue, or are there bigger constitutional and other questions at play? Now, I just want to emphasize right off the bat, I am completely in favor of the federal government getting out of the way of states, as well as government just getting out of the way of its own citizens in general. I have said that on many other topics and will continue to say that government should be there for the people to make their voices heard too, and it should represent the interests and values and ideas of the people that it represents. That means that government should not overstep either in the lives of its own citizens or the federal government overstepping into states. However, while states have the right, and they should primarily be the ones who are dictating public health for the people who are under their care, they do not have the right to dictate foreign policy. In the Constitution, in Article 1, Section 10, it prohibits states from entering into treaties, into alliances, or into confederations with foreign powers, giving the federal government sole authority over international relations. That means that the U.S. must speak with one voice on the world stage. The U.S. cannot be so fractured that we have some states that are entering into international agreements. We have some states that are joining the WHO and aligning with their guidance, but we have other states who are under our federal government. We all, as states, fall under the federal government, who then is the primary authority when it comes to reaching out to other nations. That means that if our president and if the presidential administration pulls our country out of a certain international organization like the UN, like the WHO, that states then cannot and should not go re-enter into those as a matter of constitutional priority and principle. And people on the other side of the aisle, Democrats, would agree with that because President Biden entered us into many different international treaties, different agreements, different groups. He put us back in the WHO. President Trump in his first term had tried to initiate the process of pulling us out of it. And they would say that states can't just pull out of those things. We all had to go along with it. I disagreed with it. I disagreed strongly with a lot of what he did, with the Paris Climate Accords, with so many things that were happening. But we are under the purview of our federal government. And so to a certain extent, you have to agree with them, you have to go along with them, and you have to instead push to change public opinion if you disagree with them. But you can't just circumvent the entire system and the entire Constitution. And so by California, by Governor Newsom, putting us back into the WHO, we are undermining our national sovereignty. And that is a very foolish move as well as an unconstitutional one. But even more than that, this also has implications for our rights and for how we are represented as citizens of the United States. Because like I alluded to earlier, we elect our leaders here in the United States. We elect the leaders in our federal government. We elect the leaders in our state government. We have no say in the leaders or the representatives of these international bodies. We don't know who is part of the WHO, and we will never have a voice in that matter. And so why would we disagree with the model that says we elect our leaders and then our leaders are going to evaluate all of the guidance that is given about public health policy, and then they will make the decisions. And ultimately, if we disagree with them, we can vote them out and vote someone else in who will make a different decision, or we agree with them and we continue to vote for them. That makes logical sense to me. But instead, Governor Newsom wants to move us to a model where we are just more and more dependent on these international alliances where we have no say and no representation. And again, where our interests are not the primary priority of those groups. But ultimately, this isn't a surprise because Gavin Newsom has completely ignored the large percentage of his population that voted for Donald Trump. So take, for instance, that 39% of Californians, over 6 million people in California, voted for Donald Trump and voted for his administration. Now, that's not the majority of California, but that's still a large share of it. Nearly 40% of your state does not agree with your policy priorities and instead voted for the president who is in power. And so when Newsom completely circumvents the policies that are set by Trump in this area and in other areas, when he circumvents the very policies that he campaigned on and that people then voted for because we knew what we were getting into, then he is completely disregarding the 6 million people who are under his care who are saying, we actually agree with that decision. We actually like that. That's actually how we would like to be governed. He's not governing for both parties in his state. He's governing for one party in his state. And just because you're not in the majority means that you no longer get to be represented in your government. And so on the foreign policy front, I just want to emphasize that this isn't about whether or not you agree with the WHO. It's not about whether you see it as good or bad. You could disagree with President Trump's reasons. You could disagree with some of the implications of pulling us out of the WHO, but you have to understand where he's coming from, that the federal government is the only one here who is accountable to the people of America, to the people of the United States. The WHO, the UN, they are not accountable to us. Our government is accountable to us. And so it's a complete shift in how you view the entire model that says, again, our government is going to make the best decisions for our people. And that might include some recommendations from international groups, but it is not going to automatically include those recommendations. States and the federal government are designed to work in sync. And if you disagree, because it is completely okay to disagree with your federal government. I disagreed with many of the decisions made under the Biden administration. But if you as a governor disagree with your federal government, your job is to change public opinion. Your job is to work with the federal government to make sure that your state can still represent the interests of the people under you. But Gavin Newsom has put his own interest to just directly oppose Donald Trump on every single topic above the interests of the people who are under his care, because he does not care about the 40% of Californians who disagree with him. But that's the foreign policy side of things. What about domestic policy? What about the idea of California as a state having the right to create its own public health policy apart from the federal government? How are we supposed to think about that? I once again want to emphasize that I believe government should get out of the way. I believe that federal government should allow states to have rights. States have the right to go against their federal government to set policy for their own people. And I believe that even with public health, states should know their people best. They should best know how to respond in a state of emergency, in a pandemic, in a crisis. States should know what outbreaks are going on around them, what diseases their people are prone to. And so states should be the ones to set public health policy. I have agreed and strongly disagreed with the public health policy set by the federal government. It really has depended on what administration has been in power. I wholeheartedly disagreed with the Biden administration's response to some public health things. I have disagreed even with the Trump administration back in 2020 with the COVID-19 pandemic response. And now I more agree with the MAHA movement, with RFK Jr., with the Trump administration this time around. But my personal feelings on whether or not I agree with the federal direction for public health does not change the fact that states should have the right to administer their own public health policies for their own people. That's true regardless of who is in power. But AB 144 does not do that. AB 144 does not say, well, we will create our own body for what we will determine is right, and we will consider all evidence, and we will work in partnership with the federal government to understand their guidance. AB 144 just enshrines into law that we will reject all federal government guidance on health policies, full stop, without investigating into them on their face before they've even been created. This pre-commits California to always opposing the guidance that is put in place by the federal government without even knowing what that guidance is or what it is based on, what its merits are. This is where we see the follow the science mantra completely collapse because science evolves, science changes. There is new data, there are new facts, there is new investigation, and science requires a constant reassessment of those new things. We are always evolving our understanding of science and our own methods in administering it. But declaring outright that guidance from HHS, from the CDC, from ACIP will just not even be considered. It will just be completely shirked away by the California government. That is not considering science. That is rooted in ideology, because the only factors that are driving that decision are the fact that our state is largely at odds with the current presidential administration on a whole variety of political views. And it shows us that California is not concerned with scientific accuracy. It is not concerned with having the best and the brightest and things that will really enhance our lives scientifically and in public health ways. It instead is concerned with control. It wants to control what guidance is able to even reach us as a state, what guidance is considered, who's able to make those decisions, and ultimately what decisions you are allowed to make as someone who lives here in California. A state that is confident in its science doesn't need to take these steps. It doesn't need to shield itself from scrutiny and completely wall off any other recommendations or any dissent from reaching its people. It can defend its policies out in the open. But California is not doing that. It is not choosing to actually have that open debate and consider other voices that might be different from the voices that have reigned supreme here in the state. It instead is discounting guidance. It is discounting people. It is discounting scientific evidence given by people who it disagrees with politically. That is asinine. This isn't about empowering doctors or patients. It's not about innovating science or defending science. This is about making sure that no matter how federal policy evolves, no matter what new data or new evidence is presented, that California's course is already locked in, and it is locked in largely to what it has always been and to what the narrative about public health has always said it should be. The bottom line in all of this is that California is acting like a nation state. Governor Newsom is overstepping his authority as governor. Our legislature is passing bad laws, bad policies that do not allow for individual consideration of risk and individual medical freedom decisions that you get to make for yourself and your family. And we are letting them. I care so much about medical freedom, regardless of what you believe and if I agree with you or not. I care about it because healthcare is not one size fits all, and it is not something that should be dictated by your government. I believe that each and every person should be able to assess risk for themselves. They should be able to make decisions for themselves. They should work with a doctor who they trust, with a medical provider who they listen to, and be able to make decisions again for themselves, for their families, for their children, of what they want to do for their own bodies and their own health. California is not moving in that direction, and California has not moved in that direction for decades. We have so many laws in this state that make it impossible to dissent, to move away from the largely accepted medical narrative about things like vaccines and like other topics in healthcare. And we are just continuing to push that narrative that if you disagree, that you are just outcast from society. You can't send your children to school. You can't participate in extracurriculars. You can't even talk about your views or your beliefs because you are immediately deemed wacky, crazy, kooky, someone who doesn't listen to the science. That's wrong. We should not let our state move in that direction, because then where does it end? What is going to happen? What's going to happen to our state if it walls itself off from federal guidance when it comes to things like gender affirming care? If you are someone who doesn't believe in that, if you are someone who has seen the evidence in the opposite direction of gender affirming care, then what happens when our federal government says, this is the guidance that we are going with, these are the studies that we are standing upon, this is wrong, we're not allowing for it. But California says we don't listen to your guidance, we create our own guidance, and so we are completely comfortable with it. But here is the most important part that I want to emphasize. This shift is not inevitable. Laws, policies, coalitions, all of this is passed by people, but it can be challenged and it can be repealed by people. It just requires us to be informed. It requires us to have our eyes open to what's going on around us, to the laws that are being passed, to the actions of our governor. It requires us to take a stand against what we know to be wrong and to speak up and warn others of the risks of what these decisions bring. If we look at this and we say these decisions are too big, our governor is standing on an international stage, he's meeting with international world leaders, how could we ever have a say in this? Or if we think that it is too far gone because California has had laws in place similar to AB 144, again, for decades at this point, and that have completely restricted medical freedom in our state. And so we just can't make change. If we throw up our hands like that on either issue, then we give in to an apathy that people who are in charge of our legislature and our own governor are counting on. And so I challenge you, regardless of where you stand on this, you could be the most pro-vaccine person in the world and completely agree with the medical decisions of the state of California. Or you could be someone who is more skeptical and maybe aligns more with the Trump administration or with the MAHA movement. Regardless of where you stand on this, for the sake of freedom, for the sake of conservatism, for the sake of the American ideals of what freedom is, we have to stand against this. This is not about what you believe. This is about the right for people to disagree with what you believe. It's for the right of people to live the lives that they choose to live and to raise their children the way that they want to raise them. Because if you do not have the freedom over what goes into your body, if you do not have the freedom to raise your children in accordance with your values and alignment with what you believe is right, then you are not free. Freedom demands that we allow people to live lifestyles that we adamantly disagree with, and that we instead work to persuade and inform people on what we believe is true. This is what America hinges on. We can still change course, but it requires us to wake up, to speak up, and to act before this divide between our state and our federal government becomes permanent. Thank you so much for joining me here today. I hope it was helpful for you as you navigate life in our state and that you learned something new about the laws being passed and the actions of our own governor. If you love this show, please spread the word and share it with your friends, family, and fellow Californians. And I'll see you back here next week for another episode of The California Conversation.